I would like to introduce Dr. Jamie Pennebaker. He is with the psychology department at the University of Texas at Austin. He also is an expert in trauma, and his wife just happens to be a journalist, has worked in the news business for a long time. When I asked him what, he does not have any slides, this is going to be more of a conversation, but when I asked him what he would title his presentation, he said, "Dealing with Job-Related Traumas, Upheavals, and Assholes." So that's what you're in for. And with that, Dr. Pennebaker, take it away.
Okay, thank you very much. It's actually very exciting to be here. I've given zillions of talks. I don't think I've ever given a talk to a group of reporters. And as it happens, I've been preparing for this talk for the last 40 years. So I'm going to distill the last 40 years into about 10 or 15 minutes. You know, that's just how efficient I am. So much of the research I've done over the last many years has been, how do people cope with traumatic experience? And a trauma is a very broad term. It could be, you know, seeing something horrible and gruesome. It could be the death of somebody close to you. It could be being insulted publicly on Twitter. It could be almost anything. Any kind of event that causes you or a person to start thinking about, worrying about, and trying to deal with, and ruminating about it. I want to talk first about how, as a reporter, this issue of your having to confront and report on traumatic experiences is a health risk, and then some of the ways to cope with that. But then I want to talk about how your experiences as a reporter can also be traumatizing to others. And I want to weigh in on this because there's been an increasing amount of research on the power of the media in really fucking up other people as well. And that's a professional term, so it's okay. Oh, that's right, this is being recorded. And often inadvertently touching other people off to become crazy and dealing with you, again, through Twitter or other means. And then the final thing I really want to talk about is how, in addition to some of the methods I'll talk about in terms of your personally coping with upheavals, is to think about this in the context of your work environment. Because that's really one of the primary places you need to think about, both as a cause of problems that you might be having, but also ways that you can ameliorate it. And the thing I want to push more than anything is, I want you to start thinking about a mentor to the younger people who are coming in. Now, all the research that's been done in other professions, I have not done it and I don't know of any work about newsroom people, although other than watching my wife in her early years, is that any job that confronts traumas has a much higher burnout rate than others. So for example, if you study nurses, emergency room nurses have one of the highest burnout levels. Much of what we know about burnout is in the early years, what the important issue is, how do you deal with emotional upheavals? And in certain professions, for example in nursing and in EMS jobs, and also I would guess in your professions as well, there is this implicit value which is, come on guys, you're tough. You need to go out there, see horrible things and report them in an objective way. Don't get all emotionally involved. You're upset, come on, get over it. This is what you have signed up for. Well, that's ridiculous. You are humans, and when I look at other professions that do really well at training people to deal with traumas, what they have done is to approach things very differently. So for example, being a psychotherapist. Training to be a psychotherapist is a position that requires years of training. And on a certain level, it seems ridiculous. And what happens is you have your first client when you're in graduate school. And after every meeting with your client, your patient, you meet with your supervisor and go over what was said how that person reacted, and how you were reacting. And you do this over and over again. And when I first heard how clinical training worked, I thought, geez, what a complete waste of time. And it wasn't until I started looking at ER nurses and realizing their training was, get over it. You signed up to be a nurse, and there was no actual training with, so that must have been really tough to see your first patient die. That must have been really tough to see this horrible stuff. And what you find is the survivors, some of them are the survivors of the nurses over years, some are really tough, but others had mentors who essentially did what the clinical psychologists do, which is, that must have been really tough. Let's talk about that. This is where the asshole part comes in a minute. So let's go back to your job. Being a political reporter on the surface, come on, there's no stress there. But of course there's a huge amount of stress, and there's a huge amount of stress in the nature of your job is stressful in the sense that you're getting information from people. And you're often getting information from people who are under tremendous stress themselves. And you're having to play this really interesting, peculiar role of being kind of warm and friendly because you want to get information. And in a weird kind of way, you want to use that information to write a good story, which has the potential to really mess their lives up as well. So this is unlike human relationships. Real human relationships is, I'll be honest with you, you tell me all about yourself, and this is what a friendship is. But you are, in a sense, almost exploiting this for the greater good. In addition to dealing with stressful interpersonal relationships, you also are often dealing with really horrible things. I don't know what your experiences are, but I'm sure you sometimes cover horrible deaths or murders or car accidents or whatever. But you do sometimes deal with upsetting experiences. The more you deal with an upsetting experience, the more it stays with you. If you find yourself thinking about, dreaming about, worrying about upsetting experiences a lot, the more that you are thinking about them is often a sign of early depression. Now, one of the things I discovered early in my career was I was doing some research on how people cope with early childhood experiences. And what I discovered was that people who had had a traumatic sexual experience early in life were much more likely to have health problems later on. And we studied this with thousands of people. And then at some point I started asking myself, well, what is it about a traumatic sexual experience that was resulting in long-term health problems? And I started to do some, as I would interview people, one of the recurring themes was the people who were the most messed up were the ones who had had these traumatic sexual experiences and had not told anybody. Or if they told somebody, those people didn't believe them or were critical of them for even bringing it up. And then I started wondering, well, is it possible that having a traumatic sexual experience is partially damaging because it forces the person to keep this secret? So we did other studies where we asked people if they'd had other kinds of major upheavals. They were humiliated, they were the victim of violence, they moved when they were young, or many other things. And we asked them how much they talked about it. And one of the things that came out was having a traumatic experience is statistically bad for everybody, but it's far, far worse for people who keep it secret. If you have had if you're dealing with some kind of really upsetting story, it's possible that you might tell your significant other about it, and your significant other says, I don't want to hear about this stuff anymore. Okay, so there's one person you can't tell. You tell your friends, psh, listen, I know you've got a stressful job, I don't want to hear it. And you know you can't tell your boss, maybe you don't want to tell the other people at work, and so you're living with it alone. Now, most of my career after I first discovered this early work grew from that, which I started to discover that if you get people in the laboratory and you ask them to write about upsetting experience, and you ask them to write about it for themselves, spend 10, 15 minutes a day for 3 or 4 consecutive days, write about your deepest thoughts and feelings about this issue that's bugging you, it had a profound effect on people. In other words, it helped them to start to understand and organize understand the event and to organize it. Putting upsetting experiences into words is one of the most powerful ways to deal with upsetting experience. And it does it for a lot of reasons. One is just labeling it is really important. So for example, here's something that I've noticed in myself. If I've had some kind of major upheaval, and sometimes I don't want to tell my wife, I don't want to tell my friends. You know, it's one of these things that just happened, and I'll walk down the street and I'll think of some feature of it, and I said, I should have said this. And then later on I think about it, and I think about if I just done something else, and so forth. I never stop and put all the features together. And if I'm able to stop and start writing it down, I can start to begin to see it from a broader perspective. Oh, this event is really similar to that event that happened 10 years ago, and I behaved the same way. Wow, I wonder if this is due to this, that, or the other. In other words, you start to think about the causes, your role in it, and also what has worked in the past. So that would be my very first thing. Putting upsetting experiences into words makes a huge difference. Now, to be honest, talking to another human being works very similar to writing. But the issue here in terms of in talking to somebody else is you also have to be aware of the other person. If you start to talk to another person, and I'm sure everybody's had this experience, you start to tell another person about some kind of upsetting experience, and you look at their face, and you can see their face going like, you immediately pick up, they don't want to hear this. And so you change the topic. Oh, I was just kidding. You know, it wasn't that bad, and so forth. You have to be very careful in terms of who you talk about or who you talk to about that topic. And this is one reason having a network like this is so important, because your spouse doesn't understand a lot of stuff you do unless your spouse has a similar job. Your family might not, and others. But other people, like the people in this room, they are part of a small group of people who get it. Now, another issue is you're young in this profession. It's these first years that are the very hardest to deal with. The burnout rates for your group will be the highest that will, you know, as the burnout rates are the highest now, and they drop quite a bit over time. If you make it 7 years, you'll probably survive. Of course, you're in a business that is one of the craziest, most unpredictable professions. So I can't really say that if you make it 7 years, you're going to make it, but at least psychologically, you're prepared to make it. But my strong recommendation is in these first years, really work to learn how to organize experiences in your mind. And this is what the psychotherapy training is doing, is as you deal with a client who's dealing with this problem, you start to develop, okay, I understand this better, I have an organizational scheme for it. And then another case, you do something else. And I think the same is true here. Just writing notes. And these notes writing should be personal, and it should be absolutely honest. And if you want, throw it away, because some of this stuff you don't want other people to see. And that's really important. This needs to be honest writing for yourself. Okay. The next issue is when you are in your profession, you are also, if you're a good reporter, you want to write really good stories that are compelling, that are vivid. You know, the sad reality is, we all know, no wonder Trump sold so well for the business, because people love to hate him. People seek out emotional experiences. A disaster, Ukraine, you know, if it bleeds, it leads. In reality, it's true. And what you're also trying to do in your career is to write stories that are vivid, that are personal. Well, writing stories that are vivid and personal also affects your audience. There's been some remarkable research done by Roxanne Silver at UC Irvine. And her work, the first work where she looked at this a lot was 9/11. And what she found was the more that people looked at the video images of 9/11, the more messed up they became. And she has found this now with project after project. And what this means is that your stories have the ability to affect people, so they now are reliving and dealing with these upsetting experiences. Now, why am I telling you that? Because, in a weird kind of way, that means you've made it. Wow, look at this. I got all these people to start obsessing and worrying and thinking about my article. But in some ways, just remember that what you're writing has a big effect. And then the other is, your writing also has huge effects on even, city council meetings. And by that, you may discover something that the accountants made a big error in such and such, and the city made all of these decisions, and you're reporting that accountant might lose his or her job. That comptroller is going to be reprimanded or end up in prison or whatever. And these issues it's important to think about how this is affecting those individuals. Now, one of the things I'm also interested in is, and I hadn't thought about this until I spoke with Ann about some of the issues you're dealing with, which is looking at social media. Your world in reporting is totally different from what my wife's was when she was early on, where you write a story and you get feedback almost immediately. My wife is no longer in the journalism world. She's a general writer, although she does social media stuff. She does blogs and so forth. I'm in the media quite a bit in terms of studies I've done and so forth. And I was shocked maybe 10 years ago, the first time there was an article about it in one of the papers, and there were hundreds of comments. And there was some unbelievably snotty, nasty things. And I talked to a friend about it, and he said, oh, yeah, I never look at the comments. And I don't look at comments anymore. And you're in an interesting bind because you sometimes know that your friends are looking at those comments. But as your psychologist, as today's psychologist, and by the way, I have no clinical training, I would strongly urge you to not spend much time on looking at the comments that you get. Or if you do, just squint. And if you look at the first line and says, this ridiculous reporter, then just go to the next one. Or come up with some screening, or have somebody else read them for you. But the reality is, reading personal assaults is really horribly stressful. How do you deal with this? Well, you can write about it, and I would. I would not read them too seriously. And the last thing is, sometimes you might start getting personal emails from somebody who's trying to screw with you, because in some ways you've messed with their lives, or you completely undercut their worldview. I have gotten that a few times, and when I was the chair of the psychology department, I dealt with a particular faculty member who was being hounded by somebody. One thing that I've found, that I wouldn't do this very often, is if somebody has targeted you for some reason, I would try to get inside their heads and ask yourself, who is this person? Why are they writing the way they are? And so what I have done is I have written the person, and I've said, it's clear that what I have written has been upsetting to you. You have to understand and then try to give your perspective so they can appreciate your perspective. And the few times I've done this, it has worked. And I don't recommend doing this frequently. And you are sometimes dealing with a true nut job. But often you'll find out that this person is a reasonable person. When I did it when I was the chair of the department for a faculty member, I wrote this person, I said, I know that you're upset about this. You know, I've spoken with this, but I know this faculty member. She is one of our most esteemed faculty members, and she is really concerned about this particular topic, and she's knowledgeable. And the person wrote back and said, it never occurred to me that this was a real person. And I'm you know, she was in this Twitter mentality of somebody writes something that offends her, and she sent something off, nasty thing after nasty thing, and now realizing, oh, there's a human on the other side. So that's another issue to think about. One final topic, and that is workplace issues. I was talking with my wife this morning about her experiences in the early years, and she said one of the biggest problems was, first of all, the fears of being late in getting to the story, and the second one was getting it wrong. And these were huge fears that really bothered her. But the other issue was she had come out of law school. She had taught she had worked at a newspaper. She had no newspaper training, but she started with a small newspaper in Charlottesville, Virginia, and then got a high-powered job at the Dallas Morning News. And she was her beat was in one of the suburbs. And her editor was a complete dick and was dismissive, hypercritical, and was not interested in her perspective or her life at all. And it essentially drove her out of reporting. Who you have in your environment to talk to is absolutely critical. Whether it's a senior reporter, I think you were mentioning a senior reporter, but somebody that you can talk to is really critical. And the flip side of this is when you now I was just talking to Kim and Mohammed, and it sounds like about half of you have been, about the average number of years out that you've been is about 5 years. If you've been out about 5 years, you are now at this point that you can start to mentor some of these younger people who are coming into your office. Go by and just talk to them occasionally, and be the mentor that some of you might not have had, or be the mentor that you did have. And in talking to people, ask them about what are these issues they're dealing with. Ask how they're feeling. Listen to them. You don't have to give them a lot of advice. In fact, sometimes you shouldn't give them any advice. If they say, I'm so upset about so-and-so, try a cheap trick that we do in psychology. Oh, it sounds like you're really upset about so-and-so. Yeah, da-da-da-da-da. Wow, that sounds a lot like what you said when I talked to you last week. What do you think's going on? In other words, let them talk and try to understand the event as if they were writing. So there you go. You are now ready to go out into the real world. Oh, you are already in the real world. and cope.